Doctors of Reddit, what's the biggest case of faking it you've ever seen? Taking trauma call during surgery residency. Had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects, with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with spinal cord injury without radiographic abnormality. He stayed in the hospital for a week. No improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road, naked, butt cheeks flapping in the breeze. Made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. Sorta along the same idea. Working at a pharmacy, we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw him step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated hello wave. She started to throw her arm up to but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. Not a doctor, but I'm a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet, but flushed it, and all the examinations we did came back completely normal, with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations, we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room, and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave because she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives, as she was putting herself and baby at risk of serious harm. ER nurse, bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with the specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision, and her sister only had astigmatism. They all realized she was faking it, so the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. Male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place the stethoscope near his mouth, and hear him breathe in normally, but then breathe out by saying, breathe. No joke. Male patient, 21 years old, admitted with inability to speak for last 2 hours and respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in. A few hours later, the dad tells me the boy is convulsing. I go to see without making my presence known, and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her and she is literally blowing spit bubbles. I check her reflexes, everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc., all are normal, I start checking pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube which was inserted and then removed by her in a matter of minutes. When I was a kid, I learned I could fake sick and get out of school. So 1-2 days a week it would get a migraine and hold my head and complain, and I would get to go home. Eventually, my parents took me to a neurologist who said, maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. Not me, but know an army doctor who prescribed everyone with cold-like symptoms or sore legs to stay in bed for the whole day. The next day, half as many people with symptoms showed up. Not me, but know an army doctor who prescribed everyone with cold-like symptoms or sore legs to stay in bed for the whole day. The next day, half as many people with symptoms showed up. I work in occupational health. I'm an athletic trainer. Not a doctor though. I once had a guy come in complaining of back pain. He hobbled into my office walking 1 inch at a time and groaning in pain. I knew he was faking it when I hardly touched 10 different areas on his back and he howled in pain. I looked out the window to my office and saw about a dozen baby turtles crossing. I called out for him to come look. He jumped off the massage table and sprinted over in awe of the baby turtles. I told him to get back to work. Dang it. I've been waiting for this, and it'll probably get buried because I'm late. 13-year-old girl came in for spontaneous bruising and pain in her medial ankle or calf. Symptoms come and go sporadically. Mom was really concerned. No trauma history. Look at the leg. The bruise was shiny or shimmering. I grabbed an alcohol-soaked gauze and wiped off the graphite from a pencil. Girl was mortified. Mom embarrassed. Obviously done for attention. Strongly recommend a psychiatric evaluation to mom. I always had a hard time lying, probably due to being on the spectrum, so when I wanted to get out of school as a kid, I always would hit myself in the stomach with my fist to not be lying about having a stomachache and wanting to go home. Looking back at it, they must have thought I was a victim of horrific bullying, but nobody ever said anything about the bruises. Looking back at it, this is horrible in so many ways. I saw a father and his son wink when I was turning to face them again when I was done writing a note to stay home from school. That's pretty much it. Faking it is a hard call to make in general. No doctor, but a funny story from work a couple years ago. Guy calls in sick for around 8 days, says on the phone he is really sick. Comes back to work the next week, tanned as hell. This dude hands a medical slip to the manager written in Spanish. On the slip there is an official seal from some random Cuban clinic. Guy walks over to me with a grin on his face, saying, "Yeah, I'm probably fired." He was fired. I'm an ICU and ER nurse. We get a lot of malingering in the ER. One day, one of our frequent flyers came in and started faking a seizure in triage. Now, obviously, I know this lady, and she's fake seized a million times before, but this time, it's in the lobby in front of about 30 people, who have no way of knowing that it's fake. She's lolling around on the floor, making a damn fool of herself, and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing, so she did. My mom's an ER nurse, and she said once some crazy lady came in and complained she had the whooping cough, and whenever she coughed, she followed it with a loud whoop. Guy came to ER, I was a nurse at the time. For stomach ache when asking him about history, he randomly mentions a fight with his girlfriend where she left in a tizzy and he fell asleep on the couch. 20 minutes later when we see the CT, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious how he was going to explain why she was nice enough to wrap it in the condom. Whenever we had kids, usually teenagers, playing up their symptoms to extend their hospital stay, we would order them into a healthy lifestyle. Lights out at 9, no screen time for 2 hours before bedtime, healthy diet chock full of fruits and vegetables, screen time limits, minimum number of laps around the unit per day to get in their exercise. They got better so much faster with our healthy lifestyle tips. Dermatologist here. Patient was convinced she had a melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink and that there was no spot on her skin anymore. She stormed out, threatening to sue. I'm just glad I cured her melanoma. Physical therapist here. Working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot, wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk, hips swaying, full stride, going places. We were all fools. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course, his eyes were back to normal and focused. 4th-year medical student. On my ER rotation, and a trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled bees, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay, though some of the nurses said that they caught her peeking at us when would leave the room. We ended up getting a CT scan and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally, she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. A few years ago I hated my boss, so I would have lots of migraines or headaches too severe to head into work. After seeing the same doctor a few times, he referred me to get a MRI brain scan. I played along. 3 hours later I was rushed to ER at my local hospital due to having 2 lower brain aneurysms. I never had those headaches. I was faking them. Bit of a blessing in disguise, I suppose. Was told this one by a fellow nurse I used to work with when we had a psych floor. It's not unusual for psych patients to stash things in various orifices. This one woman was convinced she was impregnated by a ghost-like figure, but no one would believe her. So one day, she started complaining of massive pelvic and uterine pain. She called them contractions. So the doctor goes to do an exam. The doctor feels something larger in there. So they prep a table to get the object out, which was quite large. So the wonderful third year helping with the procedure starts hearing this woman complain of contractions and yelling things like, "Should I push? I'm gonna start pushing." Doctor trying to work forceps around this woman's parts as to not hurt her. Finally goes, "Got." And as he starts saying it, he pulls out a baby doll, head only. The poor med student did the wobble, went all flush, had problems keeping balance, and about took a dive. I was told he didn't live that down the whole rotation. I'm not a doctor, but a nurse. There was a geriatric patient taking advantage of the call bell. Because she was an attention seeker, she always needed really basic things to get done for her, because she thought the place was a hotel. It was a rehabilitation ward, and we should try to motivate patients to do as much for themselves as possible. She would ring the bell for reasons like, "Please lift the blanket up for me," or "Please pass me my phone," or "Please feed me," and claim that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no, and that she needs to start doing things for herself, she grew more and more frustrated. Eventually she snapped, grabbed me by my collar, shook me aggressively, and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to tell her. I just looked at her and blinked as she slowly released her death grip off me. I guess I healed her hands. Praise the Lord. One upvote equals to one prayer for an old lady's arthritis.